Good morning and good afternoon to everybody. I want to welcome you to this webinar, and we will go ahead and get started so that we can keep on track with the schedule. And we're lucky we have a number of people calling in from different countries around the globe, so that's very exciting. I'm Megan Kearns. I'm the Director of the Leadership Management and Governance Project, and I want to thank you for joining us for today's launch of our Pre-Service Integration Guide. Just a little bit of background. The Leadership Management and Governance Project is funded by USAID with the goal of developing and promoting tools and approaches that help health workers be better leaders and managers. And we're currently in the final year of our project. Over the 6 years that we've been working, we've worked in over 90 countries with partners in the public and private sectors, including many civil society organizations, universities, and training institutions. The objective of today's webinar is to disseminate our new resource, the Pre-Service Integration Guide, as widely as possible and to engage all of you in a discussion about how to use it to improve leading, managing, and governing in health. We want to give health workers the skills and tools they need to effectively lead, manage, and govern health programs. By working these skills into pre-service education, we can help ensure graduates are prepared for their roles. In today's launch, we will be telling you about our experience developing and testing this guide, and we'll discuss how we worked with partners in a few different countries to integrate leadership management and governance competencies into their pre-service curricula. So first, just a few logistics. We're going to start out with presentation, and then we'll have time at the end for question and answer. As we're going through the presentations, please feel free to type any questions into the chat box in the WebEx application, and we will address as many of these questions as we can at the end. And just to minimize the distraction, please keep yourselves on mute during the webinar unless you're asking a question. And so with that, I will turn it over to Lourdes de la Peza, who will introduce herself in today's session.
Good morning or good afternoon, everybody. I'm Lourdes de la Peza. I'm Principal Technical Advisor in Leadership Management and Governance Project. I'm based in Mexico. Hello, everybody. I'm glad to introduce you to the guide. First of all, all of us need. There is a huge need of knowledge in leadership and management, because we have the medical and technical knowledge that exists to save lives and reduce illness. But health systems at all levels need a cadre of health managers whose primary responsibility is to lead, manage, and govern. So we need a cadre of people who really manage competencies that is needed to manage and lead. Sometimes people think that this is something that people learn just by experience, but we really need people that have the ability to manage properly the money, the drugs, the information, in order to provide better health services. And this is not something that comes automatically. People need to learn how to do it. So they need to learn how to do it and do it well. So we really provide good health services and promote universal health coverage. So who is the audience for this guide? We need to put this guide in the hands of deans of universities, heads of departments, committees that are in charge to develop the curriculum, the faculty itself, training and consultants, and curriculum specialists. So these people probably, they need to be convinced of the importance of this kind of training, but also they need to have the resources at hand to start incorporating the curricula into their services. So we need to assist this faculty to really introduce practical, action-oriented leadership and management competencies into the pre-service curricula. Because sometimes the faculty in our universities are accustomed to lecture people, but this is not the best way to learn how to manage and lead. So we need to assist them how to introduce something that is practical and how the students who are already adults how is the best way to train them in a way that they can start learning how to lead and manage. So in order to introduce these new curricula into the universities, it is a process that needs to be followed in order to succeed. So it is a process of leading change. So we need to start making connections with the key people within the university, people who have interest and authority, so we can lead the process to introduce this change. And then we need to do a needs assessment. So what really needs to be done? What are the kind of competencies that are needed in this precisely country and this environment? And this, based on the assessment, develop the competency framework. What are the basic competencies that are needed? And then how make the plan, how we can introduce these competencies into the curricula. And then a very important step as well is how are we going to train the faculty, because they are not accustomed to training this kind of content and this kind of curricula. And once the faculty is prepared, then we can start doing a pilot also, or something to introduce the curricula in the school. So because we knew that it is not an easy process, and we were working with some universities to try to help them to introduce the curricula. We already have 2 virtual leadership development programs with different faculty from different universities. Through the program, they analyzed what was the challenge to introduce the curricula in their universities. And then they start the process. I already showed you the different steps to convince some people, do some advocacy, were leading the change with key people, making the assessment, etc. But then we discovered that they also will need more support, not just to develop the curricula, because we already have experience in that arena. So that's why we, at the beginning of LMG, we started working with one of our partners, with AMREF, to see how can we make synergy between MSH and AMREF to develop the curricula. So we were looking what resources we have, and they have already developed with JICA a program for in-service. But this program, which was rich, but was mainly focused on PowerPoints, and it has limited adult learning approaches. So we think that we can work together, incorporating the richness of the JICA program as well as our MSH leadership program. And that's why we work together, develop the curricula together, and then we as MSH completed the pre-service guide. So something that was in our conversations with AMREF, that we really want to focus the program using the action learning approach, so that we have more active participation of the students, so they could learn by experience. So we would use this sequence, which is that every person has an experience. So the students start by, in every topic that we were discussing, they start reflecting about what were their experience related to that topic. For instance, if we were talking about the importance of the quality or client-oriented services, so what was their experience related to service in the health systems in their own country? And everybody has experience about that. So how about coming to their own experience and reflect? What happened? Why the services we are receiving are the way they are? What were the results about our experience in our health services in our own country? And then in the next step, which is conceptualize, it's to introduce a new concept or a new approach or new tool For instance, how could be a good way to listen about clients' needs and respond to the clients, and then they can understand better this new approach. And the last step is how they can apply this if they are going to work in the health services, how they can apply this new approach or this new tool in the real work. And then the circle starts all over again, because they need to go into their practices, apply what they learn, and come again to the classroom to discuss how this experience was. So based on this process, we already have developed a curricula, but we thought that in our experience, the faculty in the universities were not accustomed to deliver this kind of curricula. And so sometimes they feel uncomfortable and they don't know the concepts, the tools, the approaches. So that's why we decided to develop the guide, and that can provide a menu of modules that cover the basic subjects necessary to start the professionalization of leadership and management in the health sector. So with the guide, they can, if they don't have experience, if they don't have the content and tools, etc., they can go step by step delivering the sessions with their students. And if they have more experience, they can improvise or combine, but it was a good start. So the modules, this guide has 9 modules. The first one is to understand how the health system works, about the different levels of service and how they are integrated to provide service at the primary, second, or third, or upper levels. And it is a general module, but it is important to adapt this to their country, to their specific country. But then module number 2 is about leadership management and governance. And what is different basically from this guide and from other lectures that usually universities provide is that we focus on practices. So how you can really practice leadership and management, not about theories about leadership and management. And then the next module is about systematic problem solving, that in our leadership development program, we call it, and we don't talk about problems or challenges, but we use this language because it's more common understandable. But then they learn how to use the leading and managing practices to solve the day-to-day problems that they face at the facility and or at district levels. And something interesting about this program that is different from others is since this module 3, the students have to pick, they are supposed to deliver the curricula when they are already in the phase, at the university, in the phase that they are doing practices in the field. So they have to work with one specific facility. They are doing their practices to choose a challenge from that facility and work with a group of faculty or service providers in the facility to identify one problem or one challenge they have, and work together with them to frame the challenge and to develop, analyze it, and develop an action plan. So through the next modules, they continue implementing their action plan and using, for instance, the monitor and evaluation module to set indicators and a monitoring plan so they can follow up in the implementation of their project. And the same thing, the following modules, they are talking about resource management and what are the kind of resources they have for implementing their action plan, and then how they are going to engage other people in the health facility to work as a team and to communicate better, to integrate better, to implement the project. And then also they learn coaching and mentoring skills to mentor the team or the people in the facility. And we also have two more modules, which is about advocacy, how they can advocate for this project or other interventions that are needed. And at the end, we have the change management module that is necessary to introduce, how it is necessary to introduce any change in the health system. So that was the content of the guide, the modules, but each of, it is very structured, and each of the modules started to define specifically what are the competencies that need to be addressed to the module. As I told you at the beginning, some approaches to learning provide a lot of content, but not necessarily related to the specific competencies people need to do their job better. But in this case, every module should become focused in addressing the specific competencies that the students, when they go back to work in a health facility, will need. And then we have for each module as well, what are the performance objectives? So what they are supposed to do when they go back and work in the health system. The module has the timeline, the content, and the module is divided in units, and each unit have the learning objectives for that precise unit. And then the activities they have to follow step by step to address the objectives of that unit in particular. And then it is an explanation what preparation they need to do, what the materials, handouts, PowerPoints, or whatever they need, what equipment they will use, and then also additional resources to consult. And this, the guide has also some PowerPoints that have the basic, because the program is not PowerPoint based, but anyways, there are some slides that are needed to deliver each of the units. So we have different experiences, as I explained you. We have the Virtual Leadership Development Program, which was run twice, and we invited faculty and deans from different universities, so that were interested in introducing the curricula to the management and leadership development curricula. So through the program, we expected them to frame their challenge to introduce the curricula and develop a plan how they are going to introduce the curricula. After the VLCP, we provide technical assistance to some of the faculty or the universities that were more interested. And I am just telling you about three of them. For instance, in Kibogora, the Polytechnic School in the Western Rwanda, in 2014, they do a workshop, skill building workshop for their faculty, and they work with them to complete the review of the curricula. And then after they do that, they work with the board for approval. And the curricula was approved, so they have the first cohort of students who went into the LMG curricula that graduated in July 2015. We also have an experience with Regina Pacis University in Kenya. It's a nurse college. They face many challenges to really convince the deans and the school, but they included the LMG curricula and also the approach to experiential learning methodology for solving problems. And now the students are better equipped in the field to work at the facility level. And just now, Umuru, our partner who work with these two universities, is online. So I'm going to pass the micro to him to tell us a little bit more about these experiences, but also about the work we did in Ethiopia. Umuru, can you go ahead?
Thank you very much, Lourdes. And sorry, I mean, I'm actually in northern Kenya, very close to the border with Ethiopia. So it's good that I'm actually coming in at the right time to talk about our experience with the colleges there. I think, as Lourdes has mentioned, we've worked with several institutions of higher learning, like the universities, nursing schools, medical schools, to incorporate leadership management and governance into their pre-service. And I think it's in Ethiopia where we had possibly the most success, and with several universities. So we worked with 8 high-volume public universities there, and over a period of almost 2.5 years, we were able to work with them to integrate these practices into their pre-service training curriculum. And Ethiopia is one of the few countries that actually followed the phases that Lourdes had described earlier on, phases of the integration process. Next. So our colleague, Dr. Hussein Mohammed, who was supposed to join, actually maybe due to challenges with technology, hasn't been able to join. And actually, he was the one who prepared these slides. And it would have been really good, I mean, if he was able to share his experience. He's from Wollo University, which is in the eastern part of Ethiopia. And obviously, again, there the challenge was institutionalizing these practices into pre-service training so that they're able to train and enable students who are competent in these practice areas, and also at the same time build the capacity of the professors and the faculty so that they can offer the program on a sustainable basis. Next. So the approach that they used in Ethiopia, obviously there was considerable buy-in from all the levels of the health system, including the federal government in Addis Ababa, the regional health bureaus, and the universities themselves, and the Ministry of Education, because in Ethiopia, universities are under the remit of the Ministry of Education. So both health and education have to work together. So they were supported by the LMG project there in Ethiopia to conduct an assessment so that they can begin to figure out what are the needs, what are the things that they need to take care of in order to update their their health service management course. Because all these universities were offering that HSM course, including Wollo University. So it's not that, I mean, they were beginning from a blank slate. They already had something in place. So they reviewed that program, and that assessment also involved recent graduates of those colleges, and they want to have been deployed at different leadership and management positions within the health sector, and also looked at university instructors themselves who were teaching the course. So those were the cohorts that the assessment interviewed and they generated some findings out of that. But they basically, in a nutshell, the report, this assessment showed that most of them were not able to practice these practices and these skills as part of their professional duties. So there were gaps, there were major competency gaps. Next. So just in terms of approaches, again, they like 95% of the professors and instructors, as I said, they had, I mean, they noticed gaps within the health service management course. And looking at the responses of both categories of respondents, courses like health service, the HSM course, they thought it should include practical attachments like other clinical and molecular science courses. So the LMG project there worked with those 8 public universities, including Wollo, to begin reviewing also their community-based education strategies. Because when students, I mean, in those colleges of higher learning and health science courses, before they graduate, they do like a practicum. There's a field program that they go and work with the communities. So they felt that, I mean, they really needed to review that particular aspect as well and include these practices so that they can begin to basically enrich that practicum as well. Next. So they basically the project worked with the government of Ethiopia, conducted LMG training for the instructors who are teaching the HSM course and other staff members within the faculty, and they develop competencies for the HSM course. So I think what's really important here is instead of just taking the LDP as it were, they basically use the LDP and its content and all that to enrich an existing program, which I think is really it's a really good thing that they did. So they didn't throw away what they were doing; they just decided to enrich it and incorporate LMG practices and skills. So that was the next step, and they were able to do that for all those departments: nursing, midwifery, all the way to public health, pharmacy, and medicine. Next. So the next phase was really the actual integration itself. Working, they had like an integration kind of coordination committee, and they worked on the HSM course, included, the things that they wanted to include from the LMG curriculum itself. And at the university level, then they were able to do it also for the other departments, including the master's program. Next. So this is actually quite a bit of detail. They developed, again, what they call the team training program. This is the practicum that I was talking about. So this TTP is a very big part of anybody who does any health professional. Whether you are a nurse or a doctor, you have to go through what they call this TTP. So they standardized that, and they included LMG practices, and particularly the challenge model. They actually zeroed in on the challenge model. They took it up and they made it a strong and core part of the TTM guidelines. So all the college deans, the TTP coordinators, all the different people, the heads and the course instructors participated in that process. And I think, as I explained earlier on, the TTP is a community-based education kind of practicum, which is practiced by students of health and medical sciences. And they have a team that goes to either a health center or a hospital. And the health center there serves like 25,000 people, and the hospital 125,000 and more. So the graduating students, from all these health programs, are posted as a team to work on a project which they identify before they go out, and each student in the team is supposed to make a contribution to the activities of the team. Next. So this is now what they were able to do at Waldo, where Dr. Mohammed Hussein works, and they were able to actually do a range of things, offering a one-day orientation of the challenge model, including a practical exercise before the teams are sent out. They do that for the supervisors. They also do that for the students. They also generated a standardized set of teaching material using LMG resources and materials. And they made sure that everybody was comfortable using the challenge model. And the challenge model became part of the students' community health practice, part of the TTP, as I said earlier. And it also forms 10% of the students' TTP performance evaluation. So it was something that you really had to get your head around and be able to actually use it to solve or overcome challenges as part of your TTP experience. And I think this is a really excellent example of how to use, a system like this in a way that's sustainable and really getting results. Next. So again, all the TTP sites, the students were able to, the various teams were able to prepare action plans based on the challenge model, and they were able to do that, in 2015, 2016, 2017, in a number of years. And basically, they just identify a challenge, develop an action plan, and then work towards the results that they are set for themselves in the community using the challenge model, working, with key stakeholders at their sites, and again, mobilizing resources from different stakeholders to ensuring that they are able to operationalize the action plan. And you'll see actually some interesting examples how they were able to do that later. Next. So these are just some pictures to actually show the kind of projects that these teams were able to work on when they go on their TTP in the community. So these are just the different examples of, making sure that the pharmacy is all set. And in some places, they actually build septic tanks. In other places, they build a walk bridge to the clinic, the public toilets there. So just a whole range of things, which is, really interesting. They were able to do this as part of their TTP experience using the challenge model. Next. So this is just part of the lessons learned. I think in Wollo and in many other places, LMG has received very strong acceptance generally across Ethiopia because we were able to integrate this in pre-service training institutions in 8 high-volume hospitals that train actually more than 80% of health professionals in Ethiopia. and the instructors, of the HSM course. The course was not renamed. They still call it HSM, but with a lot of LMG skills and practices and material. So they are able to participate actively throughout the process. And college deans and the department heads, program coordinators, everybody, they've taken ownership, and it's actually now their program. And we've customized the course syllabus for other departments, and there was no resistance. And I think one thing that they constantly tell us is LMG, and especially the challenge model, is very simple, it's very easy to apply, and it helps them to actually achieve results. So maybe the one thing that has really caught on is the use of the challenge model, which is really at the heart of LDP. Next. And obviously, Dr. Mohammed was telling us that he received a lot of positive feedback from students on the value of the challenge model. And these are just examples, from the MPH, the batch of MPH students in 2016. One student was telling us, telling of a scenario where the challenge was increasing IUCD utilization. They used the challenge model, and the result that they got was 600 women utilizing IUCD in 50 days, just with using that intervention period of only 50 days. So many other positive examples in the fourth at the end of the presentation, or even the one that I showed earlier on. So in terms of recommendations, I think there's a general feeling that this experience, this intervention needs to be scaled up to other universities and not limited to the 8 universities, because they are close to, I think, 30 universities in Ethiopia. Not all of them, they train as professionals, but there are others that haven't been touched by this intervention. And there's also a realization that TTP supervisors and students need to get ongoing training, they continuous orientation, so that they can sustain the current efforts. And some departments take the course in the second year, so they not all of them offer it at the same time. So if it's offered in the second year, it's difficult to remember the concepts and skills, in the fourth or the fifth year when they are leaving. So there are challenges like that. And most new instructors who supervise the teams are not familiar with the LMG and the challenge model, because they are new people who are coming in. They are not getting the kind of training that the project was provided in the past. So new people maybe still need orientation and support. And course instructors and trainers should take responsibility for technical support, because I think if that's not sustained, then it might be difficult to go down the road to really sustain the program. So it's also ongoing support, whether it's provided locally or by through other support mechanisms. It needs to be sustained that way. Next. I think there's also a strong feeling that the coordination between in-service and pre-service needs to be strengthened. Pre-service and service coordination, because in the past, over the years, MSH, through different projects of this type, we've actually been working primarily at in-service level. I think when you continue to do that, with in-service, you are just playing catch-up all the time. So it's pre-service where this should really have started, a long time ago. But we didn't start there, and we were training health professionals while they were in the field. I think it's good to begin when they are in the training institutions themselves. So there's quite a bit of in-service still going on in this field, but it requires better coordination with the pre-service. So they should, universities, I think, and in-service institutions should work together in order to really strengthen this initiative. So the different parts of the health system, the Federal Health Bureau at the center, the Regional Health Bureau, the Zonal Health Departments, the districts, they are called WREDA health offices. We feel they should also incorporate LMG training as part of their focus areas, because leadership and governance is a key strategic pillar in this new health sector transformation plan that Ethiopia came up with, I think, a year and a half ago. It's like the major blueprint in terms of policy in Ethiopia, and leadership and governance is actually a key pillar. So the commitment is there, but they need to continue sustaining the resources to continue with this program. But we feel that even with this kind of high-level political commitment, different levels of the health system still need external support to sustain this practice, both at the in-service and pre-service level. And that coordination needs to be improved. Next. I think that's the end. Yeah, thank you very much. Any questions, comments? Thank you. Over to you, Lourdes or Megan, who was there.
Yes, thank you very much, Umuro and Lourdes, for the opening presentation. We have gotten a few questions for you, and some, Umuro, are related to what you were just presenting about Ethiopia, so we can start with those. One question is there any on-site monitoring of students when they're doing the practicals, the TPP?
Yes. I mean, they are, every TTP team has a supervisor. So the supervisors who are trained, so they actually, there's ongoing monitoring. So they're not just sent out to communities and left there on their own. So every team has a TTP supervisor, and as I think I had mentioned in one of the slides, the TTP supervisors who are given orientation on the challenge model and all that. So if they were not trained through the initial training that the faculty members received, they at least have an in-depth understanding of the way the challenge model works and how they can actually track results and ensuring that the students are achieving their measurable results. So yes, there's an ongoing monitoring evaluation.
Thank you. And then the next question about the Ethiopia experience was, who is going to do the sustaining of this process at the university? Can they do it on their own, or do they need continued support?
Yeah, excellent question. I think in the recommendation section, I talked about the kinds of support that they still need. I think because people move on, then new people come in. If they are not familiar with experiential learning and LFG, skills and practices and how to actually teach it, then that can be a gap. So that's what they're actually worried about. The kind of support that's needed is pretty limited. So you just need people with the institutional memory, if they are there, to provide that support. If they are not there, maybe try and offer it through some other mechanisms. That seems to be the challenge that they keep on raising. Because at the moment they have a pool, they have a cohort that's well trained, and they're doing a good job. They're able to introduce the course, the HSM course. I mean, it's a compulsory one; everybody takes it. But if they are not familiar with experiential learning, and that's the element that they added, and the challenge model and all that, I think that's where the gap lies, and they really need to figure out how do they sustain that using the local capacity that's been trained.
Great, thank you, Umuro. And now a few questions related to the general introduction about the guide that Lourdes was talking about. What specific content have you included in the change management module?
In the change module, we use the 8 steps that it is the model from Kotter, which is about the importance that you have a group of people who are really convinced and have the power and the possibility to introduce the change, and how you work with them to create a common vision of the change you want to create. How do you communicate? How do you then empower people to do that change, or how to put short-term wins so people can reinvigorate with achieving results, and how you can later sustain the change. So, for instance, to introduce the curricula, these steps are very, very important. So, but with any participant in the course, if they want to introduce a change in the organization, they can follow these steps to make that change sustainable.
Great. Thanks, Lourdes. And then this next question, I know both of you have experience working with universities on this. The question is, was the content of the guide prepared using adult learning theory? If so, how did that fit into the culture of lecturing in the universities that we've worked with?
Maybe Umuro can give their perspective, and I can give as well mine. My experience is that this is not easy, because they are very accustomed to lecture people, but they appreciate that when they start trying new methods, they appreciate how it makes a difference. But this is precisely why the step-by-step, not just provide them to the curricula, but give them step-by-step activities, because this way they can learn how to do it practical. If we don't provide them the activities by step, usually they took it and transform it in a PowerPoint and just lecture people. So it is not easy. That's why it is necessary to have skill building trainings with faculty. But with the guide that is step by step, we can see that we are advancing. And people start learning this new way and discovering the power. I don't know what is your experience, Umuru.
Yeah, absolutely. I think most of the people that we worked with started appreciating experiential learning and the power that it behind it, and all the sort of. It's not that they were not familiar with adult learning. I think most of them were familiar with adult learning principles and all that. But this idea of sort of stepping away from lectures and trying to draw on the experience of the learners and making sure that they actually participate and learn and discover on their own, that took time. But there were also some practical barriers around the utilization of experiential learning and sort of practical, sort of group-based kind of teaching. Like in Ethiopia, I mean, one of the universities in the south, Haramaya, which was actually also a pioneer in terms of integration of LMG, the initial reaction that we got from the professors was that here I am with 100 students in a lecture hall and the furniture is fixed. How do I do group work? And I want them to actually work in groups, but there are 100. So they have to figure out how to actually timetable and schedule students instead of 100 coming in at one time. They do 50-50 and they are able to make them sit, I mean, the furniture is fixed, they can't move it, but they were able to make them sit around and be able to do face, each other and talk, in small groups. So, I mean, they had to look for practical ideas to overcome some of those physical barriers in terms of just the furniture and the layout and the number of students.
Yeah, I have exactly same comments from people I work with a faculty in Ethiopia. Precisely, they want to learn how to teach governance in a practical way, not lecturing people. And they express similar concerns, but also other concerns about the timing they are given to provide the sessions, and sometimes they want to put a lot of content in one session that is 50 minutes, and it is not, if they want to cover all these matters just in 50 minutes or whatever, it's not possible. So as Umuru was saying, there need to be considerations in the way that the curriculum is organized, but as well the layout of the rooms and materials, etc. But they need to be creative how to do it with the scarce resources at hand.
Great, thank you both. And there's actually a follow-up question about the same topic. If you're providing a course using adult learning theory, it takes a lot longer as compared to the traditional learning style. So how are you able to keep the time and accommodate the content?
Okay, in my experience, it is, of course, it is about a design. They need to have a different design, but also, for instance, when there is a lot of content, they need to give a pre-reading so the people come to the session about reading some material, especially if there are students and they are supposed to be committed to study. So instead of providing a lot of content through a lecturing, people who in fact sometimes are not paying attention, they need to be creative to organize the session in a different way that people come prepared, and then they are not going to go through the entire content during the session. So it's a matter of changing not just the delivery, but how do you prepare the curricula, the timing, etc. That's why we need to do preview work to sensitize the deans and also the people who is in charge of developing the curricula, not just the faculty.
Yeah, and I think, I mean, if you look at the complete guide, all the modules, you'll see at the end of every module there is actually a reading assignment that the students need to be given before the next module. So it's basically, I mean, trying to avoid a situation where you offer a lot of content when you are supposed to be actually doing practical engagement with I mean, as part of the next module that you are going to teach. So there's material that they need to read in advance. And I think that way you are able to take away the content that will have, taken a professor's time. And they don't need to go through it. I mean, the students, I mean, they read that before they start the new module. So that's another strategy built into the design of the guide.
Okay, thank you. And this question is similar but a little broader. Usually when you add something to a curriculum, something has to go as time is not elastic. There's only so much time to work with. And so how do you work with the universities to determine what things go when you're adding in more leadership management and governance skills training?
Very good. That's an excellent question. In Ethiopia, as I had said, I mean, they actually embellished, they just enriched a course that they've been teaching for many years, the HSM course. And it's part of the curriculum, so they didn't throw it away. They basically just enriched it. And the time didn't, I mean, change. So the number of credit hours or the number of, contact time did not change. So what they basically did was to use the needs assessment, the competency framework that they had developed. Then they basically included the things that they really felt were important and took out the things that were either ephemeral or maybe not terribly useful. So there's really an opportunity for them they use this an opportunity to really review an old and I think a bit of a dated course. So they were able to do those two things at the same time. Then, I mean, so it wasn't, they were not doing it sort of just willy-nilly. They based whatever they were introducing on the findings of the assessment and the competency framework that they had developed, and then included just only those elements and took away the things that they thought, I mean, were either not necessary or not terribly helpful. So it was a process that was led by evidence and the findings of the assessment.
And also it takes us to another matter that is for a lot of discussion, which is we are not trying to do professional managers, because they are already studying nursing or pharmaceutical or they are going to be clinicians. So they need to have the basics knowledge of management and leadership because they will need it. But this is also a very strong discussion about the importance of introducing other professionals who are managers that don't need to be a clinician or a nurse or a pharmaceutical, but a manager in health. And this is a new cadre of professionals that need to be introduced. So we don't need to promote a good physician to become a mediocre manager. But this is another story. Because they say that, for instance, for doctors, the curriculum is already very heavy. And this is right. So we need to give them some support so they understand they can contribute. But at the same time, we need to start creating a new cadre of managers for health, which are specialists in management, not just doctors that up all the difficult to become a good doctor need to become a good manager.
Okay, thank you both. So we have time, I think, for a few more questions. And then at the end, we will tell people about where they can find this, our new guide. A question, is the LMG curriculum examinable, in other words, required for graduation in any of the places we've worked?
Yes. Hello, can you hear me?
Yes, yes.
Yeah, I think I mentioned in Ethiopia, the HSM course, which has incorporated the LMG curriculum, as part of the TTP, the practicum that they do within the community, there's a 10%. I mean, as part of the evaluation, 10% is actually tied to the use of that of the challenge model and the elements of sort of specific to LMG. So in that case, I think in order to graduate, I mean, you need to show competence in that segment of the curriculum, which I think is quite good.
I think that, of course, in every university they have to make their decisions how to take it to evaluate or not. But what we do is that precisely because it is a practical approach, and we are expecting people to acquire new competencies. When we evaluate, this is about the results they produce. In other words, if they have the ability to introduce the practical project, and they have indicators and have the opportunity to measure the results, and they achieve their results in their project, then this is what we must evaluate, not about the theoretical knowledge. So it is also a new approach to evaluate.
Great. Thank you. And then I guess one last question before we wrap up. Both of you have mentioned the challenge model, and not everybody on the call is familiar with that with that tool. Is it a standard part of the LMG curriculum, and where can we find it?
Okay, as I mentioned it is a MSH approach to solving problems. So it is a structured process, but what is different is, first of all, that we have started with a positive view. What is the vision of the result we want to create? How we envision, for instance, our health facility to work at its best. So we can have the power of the motivation of people to try to address that. And then we're going to analyze the current situation. So they use their management and leadership practices, for instance, scanning for the current situation and focusing a priority, and then pick a result that they want to achieve, which is a measurable result. And then also going to focus on what are the main obstacles and analyze the root cause of these obstacles. And then based on that analysis to produce a very practical implementation plan, how they are going to address the root causes and how they are going to achieve the measurable result they defined. So this is a process that they can identify the challenges they have in their workplace and produce very specific results and measure the results. I don't know if this answers the question.
Yes. Thank you. And just being mindful of the time, we have about 2 more minutes. And I know a number of questions have come in, and others may have questions. So what we will do when this webinar is finished, we will post that, and we can share the link with everybody on the call, everybody on the webinar, and we can also include some of the answers to the questions that we didn't get to. And then in terms of this pre-service guide, it's being finalized, and it will be uploaded onto our website, and we will also share the link to that when we share the webinar, the link and the answers to the questions that we didn't get to. So,
I'm sorry, did you finish?
Yeah, I was going to say, any last thoughts, Umoro or Lourdes?
I just want to say that there is other resource that you can find it in the MSH site. If you just scan and put pre-service and resources in the image page, you can find also the steps how to introduce the curricula. It is a document developed by Joseph Dwyer about the different steps how to introduce the curricula into your university. This is another rich resource that you can find.
Yes. Yes, and we also have our Leadership Development Plus program that was mentioned today. That's also available for download on our site, and we can include links to that as well in the follow-up email. Umoro, any last thought as we wrap up?
No, I think it's also available, as Sylvia was just saying as a note, it's also available on LeaderNet, leadernet.org. I think, just my final thoughts. I think over the years we've been working in this space for a long time, and we've learned that, all levels of the health system need well-prepared health leaders and managers, and not just clinically prepared health workers. And I think that preparation needs to begin at pre-service and not just in service. And those two elements need to be working, jointly in order to sustain a program like this. Thank you.
Thank you, everybody, very much for your attention and your participation, and have a good evening and good day.